Have you ever brushed off constant fatigue, a few trips to the bathroom at night, or swelling that just comes with age and told yourself it's nothing serious? What if I told you those small, easy-to-ignore changes could be the earliest warning signs of kidney damage that once it becomes obvious is often already irreversible? I'm Dr. Richard Hale, and after years of seeing patients arrive far too late, I can tell you this with absolute clarity. Most people don't lose their kidneys. Suddenly they lose them slowly, silently, and without realizing what their body was trying to say. Your kidneys don't scream for help, they whisper, and that's what makes this so dangerous. By the time pain shows up, by the time lab numbers finally look bad, the damage has often been building for years. In the United States alone, millions are walking around right now with early kidney disease and no idea they're on a path toward dialysis, not because it's unavoidable, but because the warning signs were misunderstood, minimized, or completely ignored. In this video, I'm going to show you how to recognize those signals before it's too late. The subtle clues your body sends long before a crisis, what's actually happening inside your kidneys when those signs appear, and how early awareness can mean the difference between protecting your independence for decades or managing a life-altering disease. If you stay with me, you'll learn how to listen to your kidneys while they can still be saved. Most people never think twice about what they see in the toilet bowl. A little foam in the urine, they shrug it off. Maybe they drank less water. Maybe they were in a hurry. Maybe it's just one of those things. But this is often the very first moment your kidneys try to warn you quietly, politely, before the damage becomes loud and irreversible. I remember a man in his early 50s who came to the emergency department for something completely unrelated. While reviewing his history, he casually mentioned that his urine had looked a bit bubbly for months. No pain, no burning, no blood. He assumed it meant nothing. But when we ran a simple urine test, the result stopped the room cold, significant protein loss. By the time he felt sick enough to worry, his kidneys had already been under strain for years. Here's what's happening beneath the surface. Your kidneys are made up of about 1 million tiny filters called nephrons. Each one contains a glomerulus, a microscopic sieve, designed to let waste pass through while keeping vital proteins in your bloodstream. When those filters are healthy, almost no protein escapes. But when they're damaged by high blood pressure, diabetes, inflammation, or long-term metabolic stress, that barrier begins to leak. Large proteins, especially albumin, spill into the urine, and proteins behave like soap. They trap air. That's why the foam doesn't disappear. This isn't just a cosmetic issue. Studies show that persistent protein in the urine isn't only a sign of kidney damage, it actually accelerates it. Protein irritates the kidney tubules, triggers inflammation, and increases oxidative stress, creating a vicious cycle that speeds up decline. In the US, proteinuria is one of the strongest predictors of progression toward chronic kidney disease and dialysis, even when blood tests still look normal. The key word here is persistent. Occasional foam can happen, but foam that shows up most days lingers and looks thick, especially when paired with fatigue or swelling, deserves attention. A simple urine dipstick can detect it early when intervention still works. But understanding foamy urine is only the first crack in the wall, because once protein starts leaking, something else begins to fail quietly: your body's ability to keep fluid where it belongs. And that's where the real trouble often begins. Once protein begins leaking through the kidneys, the damage doesn't stay hidden for long. It starts to show up in places you can see and feel, often in the most overlooked way of all: swelling in your ankles and feet. Many people blame it on long days, hot weather, or simply getting older. But in kidney disease, swelling isn't a nuisance. It's a warning. I once treated a woman in her late 50s who complained that her shoes felt tighter by the evening. She laughed it off, saying, "It's probably just gravity." But when we examined her, pressing a finger into her ankle left a deep indentation that didn't spring back. That small detail told a much bigger story. Her kidneys weren't just struggling to filter waste, they were failing to hold her body together at a fluid level. Here's the physiology behind it. When your kidneys leak protein into the urine blood, albumin levels drop. Albumin is what creates oncotic pressure, the force that keeps fluid inside your blood vessels. When that pressure falls, fluid escapes into surrounding tissues. Gravity pulls it downward, which is why swelling appears first in the ankles and feet. As kidney function declines further, the swelling can creep upward to the calves, knees, hands, even the face. At the same time, damaged kidneys lose their ability to excrete sodium efficiently. Sodium retention leads directly to water retention. Water follows salt. The result is an expanding fluid load your body can't properly manage. Clinical data consistently show that edema is one of the earliest visible signs of declining kidney function, often appearing before lab values raise alarms. This is where people get misled. Mild swelling after a long flight or a day on your feet can be normal. But swelling that persists overnight, worsens in the morning, doesn't improve with leg elevation, or leaves a pit when pressed is not benign. It's your circulatory system signaling that fluid balance has broken down. The solution starts with recognition. Simple blood tests measuring albumin and kidney function, along with a urine analysis, can reveal the cause early when reducing sodium-correcting protein loss and protecting kidney function can still make a real difference. But swelling is only the surface. Beneath it, another process is unfolding, one that drains your energy at a cellular level and convinces you that exhaustion is just part of aging. And that misunderstanding may be even more dangerous. By the time swelling shows up, many people are already feeling something deeper, a kind of exhaustion that doesn't make sense. Not the tiredness you fix with a good night's sleep. Not the slump that disappears after a cup of coffee. This is a heavy, persistent fatigue that settles into your body and quietly changes how you live your life. I once spoke with a patient who told me, "I don't feel sick. I just feel empty." He had stopped going on evening walks, stopped finishing simple chores, and blamed it all on stress and age. His labs told a different story. His kidneys weren't just struggling to filter blood, they had stopped sending a critical signal his body depended on for energy. Here's the science most people never hear. Your kidneys don't just clean your blood, they also produce a hormone called erythropoietin, or EPO. EPO tells your bone marrow to make red blood cells, the cells that carry oxygen to every tissue in your body. When kidney function declines, EPO production drops. Fewer red blood cells are made. Oxygen delivery falls, and your body begins running on empty. This type of fatigue is different. It feels like weakness in your muscles, fog in your thinking, and shortness of breath with tasks that used to be easy. Even your brain struggles because it's one of the most oxygen-hungry organs you have. Large clinical reviews, including data published in major medical journals, show that anemia related to chronic kidney disease develops gradually, so slowly that people adapt to it without realizing something is wrong. That's what makes it dangerous. You don't wake up one morning suddenly exhausted. You slide into it. You adjust your expectations. You tell yourself, this is just what life feels like now. By the time blood tests finally reveal low hemoglobin and hematocrit, kidney damage has often been present for years. The good news is that this process is measurable and treatable. A simple, complete blood count can detect anemia early. Additional testing can confirm whether it's driven by reduced EPO rather than iron deficiency or blood loss. When identified in time, correcting anemia and protecting kidney function can dramatically improve energy, cognition, and quality of life. But fatigue is still only part of the picture. Because as kidney damage progresses, it doesn't just steal your energy during the day, it begins disrupting your nights in a way most people never connect to their kidneys at all. And that next sign is one of the most overlooked warning signals there is. After fatigue quietly drains your days, kidney damage often reveals itself at night when your body's supposed to be resting, repairing, and resetting. If you're waking up again and again to urinate, this is not just an inconvenience. It's one of the clearest signs that your kidneys are losing control. I've heard countless patients say the same thing I thought: waking up at night was just part of getting older. One man told me he hadn't slept through the night in over a year. 3, sometimes 4 trips to the bathroom. He blamed his bladder. He blamed fluids. He blamed age. What he didn't realize was that his kidneys had quietly lost one of their most important abilities. Here's what's happening physiologically. Healthy kidneys follow a circadian rhythm. At night, your body releases antidiuretic hormone, or ADH, which tells the kidneys to reabsorb water and concentrate urine. This allows you to sleep for hours without interruption. That's why morning urine is darker and more concentrated. But when kidney tubules become damaged, they stop responding properly to ADH. Water reabsorption fails. Urine stays dilute, and your bladder fills again and again through the night. This isn't the same as drinking water before bed or having an overactive bladder. Research published in major kidney journals shows nocturia as an early marker of chronic kidney disease, often appearing before creatinine levels rise. Some people even notice a strange pattern, producing less urine during the day, but large volumes at night as struggling kidneys try to catch up on waste and fluid removal. Here's the red flag most people miss. Waking once per night, especially after age 50, can be normal. But waking 3, 4, or 5 times, especially if it developed gradually, is not. And beyond kidney damage, the consequences add up fast. Fragmented sleep raises blood pressure, worsens insulin resistance, increases fall risk, and accelerates cardiovascular disease. In other words, nocturia doesn't just reflect kidney dysfunction, it actively makes it worse. The solution begins with awareness. Tracking nighttime urination patterns combined with simple urine and blood tests can reveal whether your kidneys are losing their concentrating ability. Addressing blood pressure, blood sugar, sodium intake, and kidney stress early can slow or even stabilize this decline. But here's the unsettling truth. Even nocturia isn't the most surprising signal your kidneys send. Because there's another sign many people see in the mirror every morning that's quietly telling the same story, and it's far easier to ignore. Many people notice it first thing in the morning, usually while brushing their teeth or looking in the mirror. Puffy eyes, swollen eyelids, a tired, bloated look that seems to fade as the day goes on. Most shrug it off. Bad sleep, allergies, too much salt the night before. But when kidney function is declining, this is not a cosmetic issue. It's physics, and it's a clue. I once met a patient who told me, "My face just looks swollen in the mornings, but by lunchtime it's fine." What stood out wasn't the swelling itself, it was the pattern. Morning after morning, both eyes, no itching, no redness. When we checked her labs, her kidneys were losing protein steadily, even though she felt mostly fine. Here's why this happens. The skin around your eyes is some of the thinnest and most elastic tissue in your entire body. When your kidneys leak protein into the urine, blood albumin levels drop. Albumin is what helps keep fluid inside your blood vessels. When it's low, fluid escapes more easily into surrounding tissues. During the day, gravity pulls that fluid downward, often into the legs. But at night, when you're lying, flat fluid redistributes evenly and the tissue around your eyes becomes a prime landing zone. That's why kidney-related puffiness is usually worst in the morning and improves as you stay upright. It's also why this swelling tends to be symmetrical, affecting both eyes. If only one eye is swollen, think infection or injury. But when both eyes look puffy day after day, especially alongside foamy urine or ankle-swelling kidneys, need to move higher on the list of suspects. Clinical observations consistently link periorbital edema to protein loss and fluid imbalance in kidney disease. And while allergies or poor sleep can certainly cause eye swelling, those causes usually fluctuate. Kidney-related puffiness is stubborn. It keeps showing up, quietly, predictably. The practical step here isn't panic, it's pattern recognition. Morning-only swelling that appears alongside other subtle signs deserves a closer look. Simple blood tests for albumin and kidney function, paired with a urine analysis, can clarify what's happening while there's still time to intervene. But even visible swelling isn't the most uncomfortable signal kidneys send, because as electrolyte balance begins to break down, another symptom appears, one that can strike suddenly, painfully, and often in the middle of the night. And that's where things start to feel impossible to ignore. When kidney function starts slipping, the body's chemistry begins to lose its precision, and that loss often announces itself in a way that's sudden, painful, and impossible to sleep through. Muscle cramps. Not the kind you get after exercise. Not the occasional twinge you stretch away. These cramps come out of nowhere, often at rest, and frequently in the middle of the night. I once cared for a patient who described waking up with his calf muscles locked so tightly he had to stand on the floor and wait for the pain to pass. He assumed he was dehydrated or low on potassium and started taking supplements on his own. But his labs told a different story. His kidneys were no longer regulating electrolytes properly, and those helpful supplements were actually making things worse. Here's what's happening at a biological level. Your kidneys are responsible for maintaining precise levels of electrolytes, sodium, potassium, calcium, magnesium, and phosphate. These minerals control how nerves fire and how muscles contract and relax. When kidney function declines, those levels can swing too high or too low. Low calcium makes muscles overly excitable. Low magnesium prevents proper muscle relaxation. Abnormal potassium disrupts electrical signaling entirely. The result is involuntary contractions that won't release. Clinical studies show that cramps related to kidney disease tend to be more severe, more frequent, and more resistant to typical remedies. They often occur when the body is at rest, especially overnight, and may be accompanied by tingling weakness or even irregular heart rhythms, a sign that electrolyte imbalance is affecting more than just muscles. The solution isn't guessing or self-treating, it's testing. A comprehensive metabolic panel can reveal which electrolytes are out of balance and how kidney function is contributing. From there, targeted dietary changes, careful supplementation, or medical treatment can restore stability, but only when guided by real data. And here's the critical transition. Muscle cramps are painful, but they still get blamed on dehydration, age, or overexertion. The next symptom, however, doesn't hurt the muscles, it attacks comfort, sleep, and sanity itself. It's one of the most underestimated signs of kidney failure. And for many people, it's the moment life truly becomes unbearable. There is one symptom that almost no one connects to the kidneys until it starts to take over their life. It doesn't show up on the outside, it doesn't come with pain or swelling, and yet for many people it becomes the most unbearable part of kidney failure. That symptom is chronic itching. I once had a patient tell me, "It feels like something is crawling under my skin." No rash, no hives, no visible irritation. Antihistamines didn't help. Moisturizers barely touched it. The itching was worse at night, relentless, and it robbed him of sleep. What he didn't know was that his kidneys were no longer clearing waste effectively, and his skin was paying the price. Here's the physiology behind this. As kidney function declines, waste products that should be filtered out begin to accumulate in the bloodstream. Some of these toxins deposit in the skin, triggering inflammatory signals that create intense itching. At the same time, failing kidneys disrupt calcium and phosphate balance and reduce vitamin D activation. This causes parathyroid hormone levels to rise, a change strongly associated with uremic itching in advanced kidney disease. There's also a fluid paradox at play. Even while the body retains fluid and tissues, the skin itself can become dry and dehydrated. Dry skin is far more sensitive and prone to itching. On top of that, kidney-related metabolic changes can affect nerve signaling, creating a form of neurogenic itch where the sensation exists without visible skin damage. What makes this symptom especially cruel is that it's often resistant to standard treatments. Creams don't work. Allergy medications don't work. And because there's nothing obvious to see, people are often told it's just dry skin or stress. Clinical data consistently show that uremic pruritus worsens as kidney disease progresses and may not fully resolve until kidney function is stabilized, sometimes only after dialysis or transplant. The pattern to recognize is key. Widespread itching, no clear rash, worse at night, interfering with sleep, and appearing alongside fatigue, swelling, or urinary changes. When those dots connect, kidneys need to be investigated urgently, because by the time itching reaches this stage, the body's no longer whispering, it's insisting. And this brings us to the most important question of all: what happens if you listen early? And what happens if you don't? If there's one message I want you to take away from this video, it's this: you are not powerless. Your kidneys may work quietly, but that doesn't mean you're helpless when they start to struggle. The signs we've talked about today are not a diagnosis, they're invitations. Invitations to pay attention, to ask better questions, and to act while real options still exist. Catching kidney problems early can mean slowing the disease, avoiding complications, and preserving your independence for years to come. If any of these signs sounded familiar, don't panic, but don't ignore them either. Talk to your doctor. Ask for simple blood and urine tests. Make kidney health part of your routine, just like checking blood pressure or blood sugar. Small steps taken early can change the entire trajectory of your health. If this information helped you understand your body better, please save this video so you can come back to it later or share it with someone you care about. And if you want clear, evidence-based medical insights to protect your kidneys and your long-term health, subscribe to the channel. I post new videos regularly to help you recognize early warning signs, understand what your lab numbers really mean, and make informed decisions before problems become crises. Your kidneys can't speak for themselves, but now you know how to listen. And when you listen early, you give yourself something incredibly valuable: time, choices, and hope for a healthier future.